Hi, my name is Brendan Carmody. I'm the Assistant Director of the Emergency Department, and today we're going to talk about when and why we're going to use the difficult airway box and the components of the difficult airway box. This could be used on your shift tomorrow, it could be used in your shift 6 months from now, but it's important to know what is in it, so when you're placed in a situation where you might need it, you can have it available and know what to ask for. So some of the things that are going to be probably the most frequently used are people who are using the Baby McGrath. So this is the backup Baby McGrath. It is going to be in here. There's also going to be a replacement battery, which will be here. And this is something that will probably be used more frequently than the other items in the difficult airway box. There are backup blades for the Baby McGrath, and these will be placed on the outside of the difficult airway box. Also on the outside pockets will be the posterior and anterior epistaxis balloon. This may seem an odd thing to have in the difficult airway box, but especially in the area of video laryngoscopes where the camera can get clouded very easily by blood. If you have a posterior nosebleed, if you do not have this, you will never get your airway. So this will be placed on the outside as well. And if you're faced with a difficult airway with a posterior nosebleed, I would place the posterior balloon first, inflate the balloon, and that will allow decreased blood in the posterior pharynx and allow your video laryngoscope to function properly. The other one-off items that are in the difficult airway box is the rigid stylet. This is if you are using the D blade for the CMAC, and when you use a D blade or a glide scope, you need a rigid stylet in order to form the ET tube in the proper configuration. And if you don't have it, it won't work. So this will be in here as well. And the last one off will be the McGill forceps. And these are used to remove foreign bodies and other things that could be obstructing the patient's airway. And this will be in the difficult airway box. Next in the difficult airway box are the LMAs. The LMAs come in 3 sizes. They do come in pediatric size, but for the adult ED, we only have 3 sizes. The number 3, the number 4, and the number 5. The number 3 is roughly for everyone under 100 pounds. It's described as 50 kilograms or less, and that works out to about 110 pounds. So the next one up is the number 4. This is for people between 110 pounds and 200 pounds. Last is number 5, and this is for greater than 200 pounds. The most commonly used will probably be the number 4. The eye gel is removed from the container. It is on the spine, which maintains its configuration. It is removed from the spine. There's a dimple at this location, and you place KY jelly into that, and it is here that you would apply the KY jelly to the sides of the LMA and also on the spine of the LMA. This will allow easier insertion of the device into the hard palate and the hypopharynx. Additional features to the LMA is the line here is to know when you've inserted the LMA, this is approximately the location of where the teeth will be. Here is an additional port, and that port can be used to decompress the stomach. You can place the NG tube down here and it'll go directly into the stomach via the esophagus. Last, this additional location up here is highly rigid and serves as a bite block in case the patient is waking up after the LMA insertion and is biting down. Now that the LMA is lubricated here and also on the spine, you're going to suction the patient and remove all the food and or debris, and you're going to place the LMA. You insert and you direct it towards the hard palate. Then you proceed, and it should go relatively smoothly until you hit a firm endpoint. That firm endpoint is where you're stopped. It should approximate where the line is on the LMA at approximately the level of the teeth. At that point, the eye gel will be firmly seated and will not require any insufflation of balloons or anything else that alternative LMAs may need. This obviates that need because of the gel. At that point, you can go ahead and begin bag mask ventilation with the LMA in place.
The hard pallet with a continuous but gentle push until a definitive resistance is felt. Do not apply excessive force. The tip of the airway should be located into the upper esophageal opening. The cuff should be located against the laryngeal framework.
The important thing about the LMA is perhaps the indications. The reasons to use it are any time you would ever use a bag mask ventilation. So this can be somebody who is coming in from the ambulance bay, you didn't get any notice, and they're bagging the patient. To allow you to focus on the CPR and the resuscitation and getting the history from the EMS, the best and easiest way, instead of going immediately to an ET tube, is placing the LMA. That is one of the indications you can use for an LMA. Another one is if you have tried to intubate someone and you need to get their oxygen up, rather than do the bag mask ventilation, you should use the LMA and place the LMA first. It's going to be more effective. You don't have to worry about facial hair or any facial anomalies or anything else that would prevent effective bag mask ventilation. And you can place that and then allow the respiratory therapist to go ahead and do the bag mask ventilation. Another situation where you might be using the LMA is in a completely failed airway, where you've tried several attempts and you can't get them intubated and you realize you may need to progress to a surgical airway. This is an excellent temporizing device to go ahead and get the patient pre-oxygenated and ventilated to allow them to have the time to get out your Crike kit. And the Crike kit is also in the difficult airway box, and this will give you enough time to get everything set up so you can go ahead and proceed as fast and as safely as possible. So contained within the Crike kit are a 6.0 ET tube, a curved hemostat in case you need to dissect through blunt tissue. This is number 10 scalpel. This is a shortened bougie to allow facilitation of the passage of the ET tube, and this is a tracheal hook. There's also a 10 cc syringe, and how to place a bougie assisted trach will be in an accompanying video. In order to use the replacement mechanism for the difficult airway box, after an item has been removed, you take your phone, you go over the QR code, you then send it, and you pick the item that was removed. This, scroll up and hit submit. This will get sent to me and I will have Joni and myself replace the item. Thank you for your time today. I hope you enjoy it.